I've been exposed to Lumineers over quite some time. I would probably say over 15 years or so. When I purchased my first practice back in 2010, that's actually when I started offering Lumineers in my office. So it's been quite some time. I use that every single time. Like, the art is my saving grace. It allows patients to really see how the final product will be. I tell them it's a trial smile. They get to try it out. It gives me the capabilities to know where I'm reducing the case, so I actually can simplify the case for me. It makes it quicker, it makes it easier, it's just more simple, and I recommend it to anybody. It simplifies the case for me. It makes it more dialed in. I can really sell the case for the patient. I let them know that I'm using this art template, and so they understand it. It becomes more of a art as well as a science. Like, we're not just reducing like anywhere. Like, I'm telling them I'm really dialing it in to save your tooth structure so I can get the best results possible. So I love it. It simplifies it for me, and it's super fun. I think not necessarily it's changed, but it's been in alignment with what I desire to do. So my goal, what I say, is that we want to impact and empower 10,000 lives within the next 7 years. Lumineers, DenMat, it allows me to do that. So it's not necessarily changing, but it's just going in the direction where we need to go. So I have patients that we change their smile and they're crying, or they're so elated, and this is something that they've been thinking about for years, all their life. And then I'm telling them through DenMat in the lab and my team, like, we can change it in a couple days. Yes, most definitely my revenue has increased substantially with these cases that I do. It most definitely has improved from when I actually first started working with DenMat back in 2010. My production per hour before I started doing the Lumineers were probably maybe around about $400 or $500 per hour. My production per hour right now is closer to $1,200 or $1,500 per hour. Sometimes I average that. So if you look at that from I'm thinking numbers from 2010 to 2022 or whatever, where we are. So we do a great number of cases in the office. Lumineers is a part of my treatment plan, because patients may come in and they want to have Lumineers done, and they want to get a smile makeover completed. And it allows us, honestly, to, in some cases, because some people, they want to look better, but they really don't know a lot about the education of the health side of things. So honestly, because they want to get these cases done, now you see better perio numbers, you see people committed to getting their SRPs, you see people committed to purchasing things that's going to help them just to be healthier. So I've used this as a tool to allow people to get what they want as far as the cosmetic aspect, but also start paying attention to other things that's going on health-wise. It's pretty cool. So it's honestly improved it a great deal. I just did a report not too long ago and realized that Lumineers in my cosmetic cases is around about 25% of my overall production in my office. So that's pretty amazing. I didn't realize that, and I work with DenMat for basically all of my cosmetic cases. I'm doing combo cases, Lumineers, crowns, all those particular things. So it's not just veneers that we actually do with DenMat. It's everything. So if a person comes to me and they're doing a smile makeover, is what I call it, is that, it's really boosted my cosmetic approach, and it's put me in a great place because of DenMat and my relationship with DenMat in the lab. I see patients from all over the United States of America. It's fun.